Hi, I'm Herb Emery, and this is the School of Public Policy. Today we're pleased to release a report that we prepared on the impact of preventative health care on acute care medical spending in Alberta. One of the biggest challenges for the provincial government at this time is the sustainability of the publicly funded Medicare system. It's been seeing increases of 5% per year in its budget. It's now taking up almost half of all provincial revenues, and it seems to have a growth rate that isn't slowing. So the big challenge has been, how do you bend the cost curve? Most of the focus has been on making treatment more efficient, building more capacity to the system, but what we've managed to do is just make it a very expensive system of treatment. And what we've been ignoring is the potential for preventing the needs in the first place through preventative care and preventing chronic conditions to actually eliminate the need for some of those hospital beds and then eliminate some of the need for the treatment and bend that healthcare cost curve down. It's widely believed that as much as 25% of current acute care health spending is attributable to avoidable chronic illness. We identified some time ago when we were looking at the potential impacts of the increases in health care on future tax rates for Albertans in order to sustain Medicare, how much it would cost and what it would take to bend the healthcare cost curve down to make the system politically and fiscally sustainable. We looked at options like new taxes, pre-funding, perhaps more efficiency, but one of the things we kept coming back to was preventing illness and addressing that avoidable chronic condition prevalence was the only way at this stage to bend the tax curve so that we can sustain this politically. The challenge we faced is, what can a government actually encourage in order to do the prevention that's necessary to reduce chronic disease prevalence? In particular, the challenge is currently staying healthy is the most private part of the healthcare system. So we're looking for examples outside of Medicare where investments are being made that might be impacting on acute care utilization. We became aware of a program called the Pure North Synergy Foundation, which is unique in several dimensions. First, its scale. It's been providing preventative health care services to over 30,000 Albertans for about 8 years. Second, how it's financed. As a philanthropy, not for profit, this is a program that has provided services to participants at no out-of-pocket cost up until recently. So we're interested in understanding what would happen if people didn't face an out-of-pocket cost in terms of their own preventative behavior. And third, their model of care, which is based on multidisciplinary clinical teams, is of interest for general areas of primary care reform, where those have been proposed to be a useful way to deliver services without relying so much on physicians. And in addition, they're using things like nutritional interventions through dietary supplements, through doing counseling on exercise, diet, smoking cessation, so all the kinds of things that have been promoted as useful to do to improve the health of the population. What we were able to do was get information on approximately 6,000 participants from the Pure North program who agreed to provide their personal health number, which could be linked to Alberta Health Services healthcare utilization data. And we were then able to go and get an anonymized data set. We don't know who anybody is, but we do know for each individual in this sample what their healthcare utilization has been since 2003 up to 2014. With the help of Alberta Health Services, we also created what's called a matched control sample, where for every Pure North participant of a certain age and sex in a given year, we were able to draw at random a member of the Alberta population who was also the same sex and age and track their utilization over the same period of time. And what we found is that prior to the year of joining the Pure North program, participants have the same level of utilization and trajectory of utilization as the control sample, meaning without the program they look just like the general population sample we drew. What changes in the year after joining, we see a leveling off in the utilization of the Pure North participants, in other words, utilization avoided, where we saw an increase in the control sample. This is known as a differences in differences estimate, which demonstrates the impact of the preventative care in avoiding healthcare services. Based on our estimates, we estimate that about 25% of nights in hospital for this sample could be avoided. So about two visits per 100 participants per year. If we scale that to the level of the population, assuming these projections are generalizable, it actually amounts to quite a few nights in hospital, because once you go in, it's typically for something like 7 to 9 nights. So when we do that and we figure out how many beds per year would be freed up if this result was generalizable, it's equivalent to 1,000 600 beds per year made available by people no longer needing to be in them because they're healthier. This is equivalent to about 2 Foothills hospitals and more than double what we're seeing with the projected bed blocker issue, seniors waiting for an alternative level of care and occupying acute care beds. Obviously, this would be a significant relief to the system in terms of capacity. In terms of cost save, because we're looking at a relatively healthy population, they're on the order of magnitude of about $400. And so when you start to think through how should we interpret this, well, this is the immediate impact of prevention. In the first year, you reduced utilization, you save some money, you compare that to the cost of the program, which could be as low as $500, but at the period of time we're looking at, it was around $1,400. So it's the net price of prevention where the real return is the savings we can book today due to the reduction in chronic disease prevalence from diabetes, cardiovascular disease, cancer, and improved mental health. So what we're trying to point out is that prevention is not as expensive as people might think. It is effective, and it has the potential, if you can get the cost of the program low enough, to be self-financing. I think putting in the language of returns, we know at this point the return to acute care health spending is 0 at most and probably negative. We know that the returns to spending on prevention or investing in prevention is positive. If we're rational investors as a government, we should be moving resources out of acute care medical treatment and putting them into prevention. And that may be the key to the long-term sustainability of our iconic Medicare system. I'm Herb Emery. This is the School of Public Policy. Thanks for watching.